spend hours moving pieces around to make space for each patient coming in when we know it will never be nearly enough because the patients won't discharge or leave the healthcare system for extended periods of time.
Some Oregon hospitals are having trouble discharging patients. The people may not be healthy enough to go home and yet not ill enough to stay in a hospital bed. But long-term care facilities often don't have enough staffing or space. This results in people remaining in the hospital, creating a backlog of patients taking up valuable beds that could go to someone else in need.
And so these patients are waiting in hallways, in bays, in recovery rooms for days. We have gurneys in our waiting room at Asante Rogue Regional Medical Center. This is also 240 additional patients that we have to provide nurses for.
The Oregon Association of Hospitals and Healthcare Systems says statewide 449 patients are still in hospital beds waiting to be discharged. 240 patients or emergency boarders are waiting for those beds. 28 pediatric ICU beds are available in the state.
Patients are having surgeries and procedures delayed, sometimes for months. Sometimes they arrive at the hospital for their surgery to find out that there's no bed for their procedure. Patients who could get care locally end up being diverted to another community. Some patients are not receiving care at all.
The OAHHS says there could be a variety of reasons for the problem, like staffing challenges, for example. Throughout the pandemic, it's seen reduced numbers of beds in skilled nursing facilities, adult foster homes, and the state hospital even closed to new admissions. Laura Hanum, the CEO of Good Samaritan Regional Medical Center in Corvallis, says each day it's a surprise discharging patients.
We have to find out on a day-by-day basis which facilities are open, which facilities have staff beds available. And just as the acute care hospitals have been dramatically impacted by staffing limitations, we have seen even a deeper level of that proportionally with those long-term care facilities.